My name is Mike Yastrzemski. I'm a licensed independent clinical social worker, have been for almost 20 years, psychiatric social worker at Western State Hospital, and I'm also the president of the Washington Federation of State Employees. I come before you to express support more so for the original bill than the substitute bill. I have to say I was a bit dismayed at reading the substitute bill yesterday, and I can get to more of that at the end of my testimony. That said, we need to be real with ourselves. As many other people have already said today, status quo will not work. We as a state, we're amassing fines again in the hundreds of millions of dollars for not providing constitutionally required treatment to some of our most vulnerable citizens, and it's simply unacceptable. We, as in the people who actually do the job, who work at the hospital, support the idea of diversion and treatment, though we are a bit concerned about what the outcome will be if this body and the larger legislative body doesn't provide adequate resources to people in order to be successful in these endeavors. We've seen time and time again a bunch of really great ideas, especially within behavioral health, that aren't fully funded and aren't fully supported and therefore fail, which again is unacceptable. Since I have limited time and I can ramble on, I won't get into super technical specifics, folks have already do that, but I do want to touch on the changes. The state hospitals are beyond capacity. We cannot serve the ever-increasing demands with less beds, less staff, less resources. This will result in more fines and more people suffering without proper treatment. Shifting the lower level cases to the community would have gone a long way in helping that. And I'm extremely disappointed again that that was changed. It reeks of NIMBYism, to be perfectly honest. And that has never been a solution to a social issue. So I would encourage you to please consider changing that back in the final version. Thank you for all your time. And I do hope that if any of you would like to talk to me more in detail later, in depth, I would be glad to do so. Tell me where and when, and I will be there. Thank you.
I'm a member of the Washington Federation of State Employees. I am a licensed psychiatric social worker at Western State Hospital. I provide competency restoration services at the Gage Center of Forensic Excellence. Western State has received an overwhelming number of patients coming through the jail for civil commitment evaluations. These patients are vastly different than those who admit through the community hospitals. They're more complex, sicker, often unmedicated, and violent. Sometimes we know little about their social history and their mental health history, and we have to discover this information. I feel mixing these two environments, forensic and civil, is not beneficial for civilly committed patients, as forensic wards are geared toward competency restoration. This is the focus of treatment. They admit for either 72 hours or 120 hours. So for 3 days or 5 days, we must focus on this one patient and manage every aspect of their treatment. We have to determine their discharge plan, community resources, what they had, what they need, determine if they can navigate these systems effectively if they're not detained or released by the court. Do they have community notification, sex offender registration, etc.? With only a few beds opening up at a time on the civil side, we are unable to transfer these patients in a reasonable amount of time for their court-ordered treatment. We have significant staffing issues. Social work vacancies have dramatically increased due to the overwhelming number of civil patients we now have to manage. This negatively impacts our job and puts us at risk. I believe this bill is a good first step towards addressing Western's lack of bed capacity so we can better move our patients through the system. They can transition back to the community. Please support this bill.
Thank you so much.